Hi, my name is Dr. Danielle Getz. I'm an associate professor of pediatrics in Buffalo, and I'm also the CF Center Director in Buffalo. And the title of my talk is Continue to Inspire Airway Clearance and Exercise in CF and Post-CFTR Modulator Times. I have no significant relationships to disclose. The objectives of my talk are to analyze the existing evidence regarding the benefits of exercise in CF, to summarize data on the use of exercise in addition to or instead of airway clearance, to examine the views of CF patients and providers regarding exercise as part of a treatment plan, and to determine whether airway clearance or exercise beliefs have changed in the post-CFTR modulator times. As many of you know, the CFTR modulators result in improved CFTR function at the surface of epithelial cells throughout the body, thereby decreasing sweat chloride, improving lung function, growth, and other parameters in many people with CF. This is a list of the availability of CFTR modulators in the United States as of 2020. We started with ivacaftor in 2012 and now have moved to elexacaftor, tezacaftor, ivacaftor, also known as Trikafta, approved in October 2019 and expanded down to age 6 in June 2021. There are different activities that we talk about. Habitual physical activity is bodily movement produced regularly by the contraction of the skeletal muscles. And exercise is planned, structured, and repetitive bodily movement performed to improve or maintain one or more components of physical fitness. Sports are any activity involving physical exertion and skill in which an individual or team competes against another. Exercise is beneficial in CF and can help with aerobic exercise capacity, muscle strength, bone mineral density, and mental health. I found one quote stating, "Exercise therapy is more easily accepted by any society, which helps to normalize the lives of CF patients, rather than placing a psychological burden on them." So does exercise really count as airway clearance? This is something we can look at more. A Cochrane review in 2017 included 15 studies with a total of 487 CF people. There are limited evidence from both short and long-term studies showing that aerobic or anaerobic physical exercise training, or a combination of both, has a positive effect on either aerobic exercise capacity as measured by the VO2 peak in 4 out of 7 studies, FEV1 in 2 out of 11 studies, and health-related quality of life in 2 out of 7 studies. The current international guidelines recommend exercise as an adjunct to, but not a replacement for, traditional airway clearance therapy. The CF Foundation published their guidelines in 2009, where aerobic exercise should be an adjunct for airway clearance. The Thoracic Society of Australia and New Zealand published their guideline in Respirology in 2016 and showed that physical exercise does reduce mechanical impedance of sputum and does improve pulmonary function and expectoration. And the CF Trust in the UK showed that physical activity and exercise should be a part of any management of CF at any age. Another review article I looked into was of 12 studies showing the physiological rationale for exercise as a form of secretion clearance. In one study of 12 participants, there was an increase in LCI, in cycle ergometry, and this was not seen with PEP therapy. In another study, cycle ergometry was compared to active cycle breathing techniques, and there was an immediate increase in FEV1 in both of them, but no change for either at 30 minutes. In another study, mixed exercise improved the FEV1 compared with active cycle breathing techniques when measured after a 40-minute recovery period. A meta-analysis, including 3 trials, found that the addition of exercise to airway clearance increased FEV1 compared with airway clearance therapy alone. This is the summary article of the exercise studies included in the review and their relevant outcomes that were measured. One team with multiple studies comparing airway clearance and exercise was Tiffany Dwyer from Sydney, Australia. They have done studies, 3-day randomized controlled crossover trials in adults where they do resting breathing, treadmill exercise, and PEP therapy, and they compare mucus clearance. In 2019, their study showed that treadmill exercise improved whole lung mucus clearance compared to resting breathing. However, exercise alone was less effective than PEP therapy. In 2017, treadmill exercise was compared to flutter, and there were significant increases in peak expiratory flow, but only the flutter created an expiratory flow bias. Treadmill exercise improved ease of expectoration, and flutter therapy improved subjective sense of chest congestion. There was no significant difference in the peak expiratory flow between the two treatments. And CHEST in 2011, they published an article where the ease of expectoration improved following exercise after a 20-minute recovery. A rare longitudinal study published from Toronto in 2014 showed that the rate of FEV1 decline was actually slower in patients who had more habitual activity, going down from 1.9% per year to 1.39% per year in those who had increased habitual physical activity. Another longer-term study was done in the hospital of 17 participants where they compared airway clearance with exercise. And there was actually no difference between the interventions in terms of FEV1, FVC, and FEF25-75, showing that perhaps exercise can be used as an effective replacement for airway clearance. What do patients think about exercise substituting for airway clearance? An Australian survey of 692 adults showed that 43% of participants believe that exercise could be used as a substitute for airway clearance. And this has been the case in several prior studies as well. Another study in Australia in 2007 demonstrated that people regularly exercise 90% of the time, and 10 out of 57 patients, or 17.5%, reported exercise as their only form of airway clearance. A study in the UK and Australia published recently was of healthcare providers and people with CF and their caregivers from 12 different countries. They showed that physical, psychological, and social factors were motives for physical activity for the patients. Common barriers included time, tiredness, and also psychosocial barriers such as stigma and cost. Similar to exercise, airway clearance is recommended, but unlike exercise, there is much more evidence on good health outcomes like FEV1 and lung function. And there's no proven benefit for one type of airway clearance over the other. However, there is some patient preference in the studies of autogenic drainage as compared to percussion. High frequency chest wall oscillation may be the worst in terms of pulmonary function and number of pulmonary exacerbations, perhaps due to the fact that the patient may not participate actively in the treatment. Airway clearance must provide an expiratory airflow of more than 30 to 60 liters per minute to be effective. So there are a lot of beliefs and practices already about airway clearance and exercise, and then we add the Cftr modulators. So are these beliefs and practices changing as we even speak? So in order to get at this question, we decided to do a survey with CF Community Voice, who helped me so much in obtaining this data. So we decided to solicit feedback from patients and providers on their practices regarding exercise and airway clearance. A total of 153 community members and 192 providers completed the survey between July 20th and August 3rd, 2021. In terms of the community, there were 74% of the respondents that were people with CF and 26% that were parents. These are their age ranges in terms of the community respondents. In terms of the modulator they were currently taking, 77% they were currently taking Trikafta, and 17% were not currently taking a modulator. These were the previous modulators used in the past, reported by the community. In terms of the providers, 47% were physicians or PAs or NPs, 31% were respiratory therapists, and 38% of the providers were in practice more than 20 years. And the other ranges of the times they had been in practice are presented here. 44% of the respondents were from the pediatric centers, 31% adults, and 25 did both. And you can see that the center size distributions are pretty even, except for 100 to 199 is the most. In terms of the number of treatments per day, the community respondents largely said they complete 2 treatments per day, and 65%. This was 56% of adults and 86% of children. The next most common response was 3 treatments per day. Most patients indicated they had not stopped taking any medications since they have started a CFTR modulator. They did write in the following medications as ones they may have stopped. Since starting a modulator, most respondents in the community said they have not stopped all airway clearance. Only 13% stopped. Almost half said they have not changed their airway clearance at all, and 30% do fewer treatments. Since starting a CFTR modulator, have you discussed changing airway clearance treatments with the team? Half of people said they have. More parents said they have not discussed decreasing the treatments, and it's unknown if this is because they thought that wasn't a possibility or they just weren't comfortable discussing it. In terms of providers prescribing Trikafta, 50% said they have decreased airway clearance therapy prescription, and 48% said they have not changed any airway clearance prescription since any modulator was started for the patients. The minimum length on a modulator before considering decreasing airway clearance therapy was 26% said 4 to 6 months, and 23% and 22% said 1 to 2 years and more than 2 years, respectively. In terms of the criteria for decreasing airway clearance, providers said lung function stability over a time period was important, number of exacerbations requiring antibiotics, patient family requests, and patient exercise on a regular basis were all important. 39% of physicians said they have not decreased airway clearance. In terms of exercise, most respondents said they do exercise, and the categories were pretty equal in terms of mild, moderate, and vigorous exercising. In terms of exercise frequency, most people said they exercise between 4 to 7 days per week. In terms of the community, those that consider exercise as part of airway clearance, 59% said yes, exercise can supplement airway clearance. 20% said exercise can replace airway clearance, and 21% said exercise is different from airway clearance. In terms of the providers, 78% of providers do prescribe exercise as part of the treatment plan, and 68% of providers said that exercise can at least partially replace airway clearance as part of the treatment plan. 21% said that it cannot replace. Since modulator use has your opinion about exercise as a form of airway clearance changed, largely all the community said no, it has not changed. And then in terms of providers, have modulators changed your opinion? 33% said no, it can still partially substitute, and 36% said yes, it has changed my opinion that they are on a modulator. Now airway clearance can be partially substituted by exercise. Has COVID-19 affected exercise levels? Providers said 45% said that some exercise more and some exercise less. And in terms of the community, about half said they exercise the same amount. So in terms of the comparisons between the providers and the community, 78% of providers prescribe exercise as part of a treatment plan, and at least 64% of the community says they exercise 4 to 7 times per week for 20 minutes. 68% of providers said exercise can partially substitute for airway clearance, and this was around the same in 59% of the community. 21% of providers and 21% of community said exercise is different from airway clearance and cannot substitute. Only 7% of providers said exercise could completely substitute for airway clearance, whereas 20% of the community say this is true. In terms of providers and community, 59% of providers and 83% of the community felt that modulators did not change their opinion about exercise in relation to airway clearance. In terms of airway clearance prescription and use, before starting modulators, 65% of the community did 2 treatments per day. After starting their patients on a modulator, 50% of providers prescribing Trikafta recommended decreasing airway clearance. They did not change their airway clearance for patients on Orkambi or Symdeko, and 48% of providers have not changed their airway clearance prescription for any modulator. After starting a modulator in the community, 13% stopped airway clearance completely, 54% did not change their airway clearance, and 31% do fewer treatments. So in summary, providers and community have similar numbers in terms of prescription and actually doing frequent exercise. Providers and community members are close in terms of their beliefs that exercise can substitute partially for airway clearance. 21% in each group said exercise cannot substitute for airway clearance at all. More community members, 20% compared to providers, 7%, thought exercise can completely substitute for airway clearance. Providers thought community exercise is less during pandemic. Most of community reported same amount of exercise during pandemic. And modulators did not change the opinion about exercise replacing airway clearance in 59% of providers and in 83% of community members. So what should we recommend in terms of exercise? In order to have any measurable benefit on exercise capacity, exercise training should be performed for at least 6 weeks, 20 to 30 minutes at an intensity of 55 to 64% of the maximum heart rate for 3 to 5 days a week. It is recommended that huffing and coughing are included to maximize mucus clearance. The change in expectoration seen with exercise may be seen later than is seen after airway clearance therapy. In the trials, it took an additional 20 minutes for the change in expectoration to occur. So there are many things to consider when deciding whether or not to reduce airway clearance, as we discussed, but 39% of providers have not recommended reducing airway clearance at this point. So I'd love to get your input on what you think about exercise and airway clearance in the post-Cftr modulator times. And we'll have a chance to discuss in the discussion section coming up. I really appreciate you listening to my talk. And I really, really wanted to thank Jessica Hudson and Enid Elias from the CF Foundation, and they work with Community Voice, and they really helped me to distribute the survey in a really fast and expedited fashion, and it was very thorough in terms of the results they presented, and I shared a lot of those results today. So thank you so much, and I look forward to talking with you, and have a great day.
Hello, welcome to the next talk in our symposium, Airway Clearance and Exercise in the World of Modulator Therapy. Can we lighten the load? My name is Joe Russo, and I'm a pediatric pulmonology fellow at the University of Florida. Today, I'll give my talk entitled Completing the Trifecta, the Role of Exercise in Airway Clearance and Modulator Therapy. I have no financial relationships to disclose related to this presentation. We'll start the talk today by briefly examining the concept of reducing treatment burden and look at some differences between what patients consider burdensome and professionals. We'll explore the interrelationships between exercise, airway clearance, and highly effective modulator therapy, and look at the overlap areas between them. We'll take a look at some recent literature that focuses on the potential of exercise to take a lead role in airway clearance regimens in this era of highly effective modulator therapy, and look at the importance of exercise as a way to help address the emerging trend of patients with cystic fibrosis that have elevated BMIs approaching unhealthy levels. And finally, I'll discuss an approach to exercise in general based on this emerging data that we discuss. So to get started, I really like this specific international survey that was given to patients and families, as well as professionals, including physicians, respiratory therapists, physical therapists, dietitians, in ranking what each group felt was the most important, as well as the most burdensome aspects of cystic fibrosis treatment. And I think two key takeaway points here are, number one, that professionals and patients agree that exercise is among the most important aspects of the treatment regimen for cystic fibrosis. And second, that patients don't find, or at least rank, exercise as one of the most burdensome aspects of treatment, as do professionals. So although we don't have direct information regarding how many of these patients actually participated in regular physical activity, it wasn't ranked as a burdensome aspect of treatment. Another important point that is brought up by this survey is that it confirms that airway clearance is the most burdensome of the treatment regimen, which we know. We know that patients can take several hours a day doing airway clearance, cleaning equipment, taking medications, and that airway clearance in particular has been a target of some TDN studies, including the Simplify study, to see how patients fare without the inclusion of hypertonic saline or pulmozyme in their daily regimen. So, taking that into consideration, I wanted to discuss what I've referred to as the trifecta, and I'll call it the trifecta of the hour, because I recognize that although I'm focusing on these three components of treatment for cystic fibrosis, there are many others that are important for optimal patient health and that impact the relationships of these three. But in looking at the three aspects of modulator therapy, in particular the highly effective modulator therapy with Trikafta, aerobic exercise, musculoskeletal exercise, and then airway clearance, thinking about it in terms of traditional techniques such as BEST or IPV, and then noting the overlap with exercise, which is also considered a component of airway clearance, in addition to the effects that modulator therapy now has on both of those other modalities, such as airway clearance, improving it through its mechanism of action. Because patients are feeling better, they're able to participate in more exercise. So there's lots of overlap and lots of interrelationships between these three. And so I just wanted to clarify that I recognize that there are other important aspects of therapy, but I call this the trifecta for our particular talk today. Taking a closer look at how modulator therapy affects airway clearance, I'd like to start off with a quote from one of our cystic fibrosis patients that we follow in our pediatric cystic fibrosis clinic. She said that within a few days of starting Trikafta, I had an easier time clearing my lungs, and I was able to take a deeper breath than I had for years. So this is just proof of the facts that were starting to be borne out in the research literature, just confirming those known mechanisms of Trikafta on the chloride ion channel, which really changes the quality of the sputum that's produced and improves mucociliary clearance in the airway, thus making it easier for the patient to breathe, feeling more energetic, able to participate in exercise, and being able to do things that maybe they haven't been able to do for years. Some patients are beginning to take up running. They're beginning to do hikes, long bike rides, things that are important for their health overall that previously they would have felt too short of breath or too fatigued to participate in. And I think that that's a very important point when we look at specific areas of barriers to participation in physical activity, particularly in the adolescent and young adult group. This article from Denford kind of examined barriers to increased participation in physical activity in CF patients, particularly centered around a number of criteria, including those such as fluctuating health, the feeling of normality, beliefs about their control over their health, and other perceptions of physical activity and the value that they place on physical activity. So we can see that with modulator therapy in the picture, a lot of these areas are changed for the better. So the patient begins to feel better. They feel like they have more control over their health. They feel that they're able to participate in more normal activities with their friends. Fluctuating health may be less of an issue. And so a lot of these barriers to physical activity are kind of taken down. And many patients are seeking out the opportunities to become more physically active, which is a positive as we continue to discuss how important exercise is becoming in this new environment of the highly effective modulators. When thinking about exercise and airway clearance, it's long been postulated and studied as to whether we can recommend aerobic exercise as the main component of an airway clearance regimen. And we know that there are patients that tell us anecdotally that they typically have mainly do exercise in place of vest therapy or other modalities. But in terms of being able to make recommendations on a larger scale, looking at the literature, we need to really think about what evidence we have at this time. And I think a really good place to start was a recent review article by Ward et al. That kind of looked at a group of 12 studies that were mainly all within short time frames, somewhere around up to 2 weeks in range, where traditional airway clearance techniques were compared with physical activity and exercise, and particularly focused on those changes within the studies on FEV1 and the weight of sputum as an alternative way to get an idea regarding airway clearance. And really, for the most part, by looking at this group of studies as a whole, it appears that there is equivalency, at least on a short-term basis, between traditional airway clearance and exercise, particularly and importantly, with forced expirations incorporated within the activity. In that situation, there was little difference between the two modalities. We still lack longer-term studies to go along with those findings. It's definitely an area of research that's active, and we would expect that there would be some data within the coming months looking at this further. As we discussed, patients with cystic fibrosis are now in a position to be more physically active. Many patients are seeking out to be more physically active, and this is going to be a nice addition to their therapy if we can replace a portion of their airway clearance with exercise. when we think of the other side of the coin, and we want to look at how highly effective modulator therapy has affected the nutritional status of our patients, we note that even with earlier versions of modulator therapy, such as ivacaftor, and this is an excellent look at the literature by Bass et al., recent in the Journal of Nutrients, that there had already been a trend in increased weight, some increased BMI, even with, again, the earlier versions of modulator therapy, such as ivacaftor. Much of the research remains to be done. We don't have all the data back to look at Trikafta yet, but we know that from what we're seeing now, there are increased BMIs, there is increased weight. And in our clinics, we know that there is a group of patients that are getting elevated BMIs to unhealthy levels, increased fat mass, and this is becoming a more of an issue with the cystic fibrosis population in general, as more patients are able to benefit from the highly effective modulator therapy. The concern that comes about once BMI levels are getting to unhealthy levels is that, in combination with an increased lifespan from these modulator therapies, these negative changes in body composition can really combine to increase the cardiovascular morbidity in the cystic fibrosis population. And I think it's of particular concern as younger children are able to start this medication. It's going to be very important, the patterns of behavior and recommendations that we make in this age group as they continue to grow and develop patterns in their behavior for a healthy lifestyle. Some additional evidence that looks at what's best correlated with measures of health in cystic fibrosis, such as FEV1, is really fat-free mass. And this study is looking at data prior to Trikafta, but it noted that the fat-free mass did correlate better than BMI with measures of pulmonary function. And they were looking specifically at a group of patients between the ages of 12 and 39 years. So we can expect that, changes could be more pronounced as we see higher BMIs, more perhaps fat mass in the patients than in these prior studies. And so it really highlights the need for exercise recommendations to start to be put in place to complement perhaps changes in our nutritional recommendations as well for these patients as they're being monitored through their CF clinic visits. And so taking these kind of bits of information into consideration, I think that a general approach to exercise recommendations moving forward, as we're gathering data regarding exercise as airway clearance, exercise and its role in increasing BMI and caloric intake of our patients, is I think that first, we don't really have enough evidence currently to widely recommend exercise as the main source of airway clearance. I think there's a lot of data on the way. There's many research studies currently collecting data. And really, it's going to take a longer term study, but in greater attention to the intensity and frequency of exercise will certainly be needed. I think that there will be a need to be perhaps more specific about the exercise prescription if we want to put exercise in the place of traditional airway clearance. And these things will start to be borne out in the literature as time goes on. A shift in focus of the exercise prescriptions also toward the burning of excess calories and promoting cardiovascular health for the long term. And I think that that is something that is certainly more on the radar of all of us in cystic fibrosis clinic these days. Monitoring that group of patients on highly effective modulator therapy who are having elevated BMIs and just increased caloric intake rather than just coming up to a healthy level of BMI. And a lot of monitoring around that needs to be done. But there's definitely going to be a role for exercise in the solution going forward with that. And I really think from speaking from a pediatric pulmonary perspective, that the patterns that we help generate in our patients, particularly our younger patients that maybe are starting Trikafta at the earliest age at this time, it really instilling the importance of physical activity and dietary changes as needed as they grow, as we're monitoring their BMI, I think is going to be really important to make these lasting behavioral changes as they grow toward adulthood. Because as we discussed earlier, a longer lifespan with perhaps less healthy behavioral patterns could really lead to excess cardiovascular health issues in the future. And at our center, we've began a process of making sure that all our pediatric patients starting at age 5 are evaluated by a physical therapist. This is something that we hadn't really had in place, but really found the importance of getting that started and developing a physical therapy assessment program for our patients starting at an early age. And we're hopeful that with the exercise recommendations that are in place and monitoring that's in place, that will lead to better outcomes. So in summary, I'll just wrap things up by saying that this is truly an exciting time to be involved in the care of patients with cystic fibrosis. The advent of highly effective modulator therapy has really set the stage for a challenge for all involved in recommending exercise and physical activity for patients with cystic fibrosis. As we discussed, the Trikafta has really improved the airway clearance of our patients. They can breathe better, they have more energy, are more willing and able to participate in physical activity, and really puts that challenge on our plate to provide recommendations and continue to work with these patients to optimize their health. And I feel overall that exercise is likely to continue to rise on the scale of most important interventions to keep our patients healthy. Here's a list of my references. And I thank you for your attention. I'm looking forward to our question and answer session. Thank you so much.
Hi, everyone. I'm here with Michael Sellers, who is a patient at the Adult CF program in Rochester, New York, and he has graciously agreed to share some of his CF story with us and his experience with highly effective modulators. So thanks so much for joining us, Mike. We really appreciate the patient perspective on this. Can you tell us a little bit about your CF story, when you were diagnosed, what symptoms led you to be diagnosed, how your overall health was as a kid, and what your therapy regimen looked like when you were a young child?
Yeah, and thank you, Donna, for having me. I'm glad to be able to do this. So I started off with a cancer unit at 4 months old back in 1990, and they didn't really know too much about CF at that point. They knew it existed. They didn't know a lot of signs, symptoms, tests, everything else, except for I think like the sweat test was the big one. But they did a whole bunch of blood tests. They said my liver was 4 times its normal size. So that led them to believe the cancer out first. So they did a bunch of tests at that point. Nothing was pointing to cancer. One of my doctors on the team said, "Hey, how about we try and run a sweat test on this patient?" So they ran the sweat test, and from what I was told, it came back like 4 or 5 times its normal reading at that point. So they said, okay, let's check out cystic fibrosis a little further and make sure he's got the other signs and symptoms of it. Turns out, yep, I had cystic fibrosis. My mom at that point, she was nervous, like any other parent would be when somebody's told that you got cancer, cystic fibrosis, anything, a debilitating disease, anything like that, illness. It was tough. Again, I lived my early life through my mom and the doctors that I used to talk to one up until I was 16. I don't really know the exact details of what happened, but from what my mom had told me, it was a rough road. I was pretty much the first 4 or 5 years of my life in the hospital, in the hospital than at home. Didn't really know which place was my house. That was the big thing there. So my mom worked 2 or 3 jobs just to get by at that point, because 93, my father had left the picture. So my mom was taking care of me and my brother and my sister, and I was the baby of the family. And it was tough on her. She had to quit most of her jobs there. She started taking up babysitting teachers' kids during the school year so she could be home with me, because I needed that attention. It was critical. I had somebody there to be able to watch me. I could, my health would turn in a flip of a switch. It still could. It still does. Not nearly as frequently, but it still does. I had that family support there for my mom from day one, and she's still there. I'm 31 now, and she still sends me a text message of, "Hey, how you feeling this morning?" Every single morning. "How are you?" And then at night, "Do you get all your medicine done?" As I always get that text about 8:30, 9 o'clock. "Get all your medicine done. How's the kids?" That's the big thing there. Again, family is the biggest thing I found, is probably the true medicine, I would say, for somebody with cystic fibrosis, just that support system there. And I'm grateful that I've had that pretty much from day one. So
your mom encouraged you to do all your treatments as a young kid, and then as you got up to adolescence, how did that go? Did you have any rebellious period or?
Absolutely. I don't know what kid wouldn't, but I think a little more for me. It was tough. At that point, I was starting to see what normal kids, quote unquote, would do in their everyday life, and just seemed like it was like my kids now. They run outside, they play, they do whatever they want to when they want to at that point. They're out until 9 o'clock at night playing hide and go seek and things like that, where I'd have to stop and come in, and up, mom's yelling at me to do my nebulizer. I've got to go do my vest. I've got to take my pills, all that. Or if it was too hot out, that was the other thing. Kids were outside and in the sprinklers and the pools and everything else, and it's 90 degrees outside and humid as all heck in New York, and I'm stuck inside in the air conditioning. It was, I can't tell you how many times I told my mom it wasn't fair. And I know that, not looking back at it, that killed her, hearing that. And I didn't understand at that point when I was 5, 6, 7 years old, exactly what she was trying to like protect me of at that point. So weather played a big factor in developing lungs with the heat, the extreme cold. You'd have to go out with a face mask on. I'd say, "Mom, why do I have to wear this thing?" Even on airplanes at that point, I didn't even really think about that one. I'd have to wear a mask, and why is nobody else wearing one? That's the big thing. And I'm now seeing that as my oldest is 6 now. And if now with COVID going on, having to wear a mask, things like that, they start asking those questions. And now I know how my mom felt when I'd ask her those questions. It's a tough spot. So I owe everything to my mother. I don't think I'd be here if it weren't for her. She'd sit on me to do my nebulizers and put the mask right to my face and say, "You're going to do this." That's just how she is. And I think she still would be at 31. She'd still try and tackle me and do it. But she really forced me to take the reins myself. Probably, I'd say about 15 years old was the real, "Let's throw it all on you. You need to do this." And I went through a stage where I didn't want to do it. And she goes, fine, Michael, you do what you want to do. And it was about a week later, I got really sick. I wasn't doing my nebulizers. I was doing some of them, but not at that time. I was 4 times a day. Vest was 2 to 3 times a day. All my medicines, the pills, everything else I had to take. I didn't really realize how all that stuff kind of meshed together and made me be able to breathe. That was the thing. So I ended up in the hospital. I was in there for a 3-week IV stay. And that kind of woke me up. And I said, all right, I guess this is a serious thing. My CF is serious. I've got to do something. But from day one, I kept hearing these things of, I'm only going to live to 5. I'm only going to live to 8. I'm only going to live to 12. It just kept on going. And I'm an optimistic person. That's how I am. I always see the positive in everything. Or, hey, you shoot 100, I'm going to shoot 101. Things like that. That's what I have been like from day one, on top of my mom being there for me. I feel like that's what's really driven me. And the support system, I keep hounding the support system. That's huge. It wasn't just from home. I'd have the CF center that would be right behind me. Every which way I turned, any questions I had, or, hey, Mike, you could do this, but this could be the consequence. I get that from the doctor's office and at home, both sides. But growing up, it was definitely tough. I played baseball, I played basketball, I ran cross country and track. That kept me going. I actually had my freshman basketball coach, as my mom came to pick me up, and say, should he be doing this? And my mom just kind of looked at him like, why shouldn't he be doing this? Yes, this is what's keeping him going. So the constant exercise, every single day practices and games and things like that really kept me going. My lung function was above 100 for a long time. I think it started dropping as soon as I crossed high school to college, where I stopped that everyday basketball or baseball or anything like that. So that's really, I think, where I started seeing that decline, probably about 18, 19 years old. And it dropped off a cliff pretty quickly. That was a thing. And it kind of shocked me, made me nervous because, oh my gosh, I was told I was only going to live to 18. And all of a sudden at 18, I'm taking a cliff dive with my lung function. And said, is this happening? I didn't have still at 18, I didn't have that full understanding that, hey, you can recover, it can come back, but you've got to stay on your regimens. So I did that. Again, thankfully for that support at home and the constant drive to, hey, do your medicine, do your medicine, do your medicine. I kept that going. And if I didn't do that, I don't think I'd be here either today. Mm-hmm. That's the big thing. And then along came modulators. That was the big thing. I wasn't eligible for Cali-Deco because the genetic makeups, things like that. But I was eligible for a combi at that point. So I was all excited to take it. I was all ready to take it. And I was like, wow, this is the first big medicine that is going to help me. But at that point, I started the Oricombi and I just felt horrible at the first few days. I felt like I had a really bad flu. But then I still didn't feel 100% normal. A few days later, a week later, I still felt like something was off. My lung function came up a little bit. So I said, hey, this is working. Let's keep going. Whether I don't feel well or not, I'm just going to keep doing it. I stayed on that for as long as I could until Symdeko came out. And I rolled the Symdeko. That I had far less side effects too. That helped me tremendously too. I felt normal again with that, but I didn't have the huge increase. Again, I'm a data as a numbers person. I look at all the studies and I've looked at these past studies and I was in a couple of them before too. And I see, people had like a 10 or a 15% increase. I wanted to be that 15 or 16 and I wasn't seeing that. So I got disappointed at first, but then I had to step back and say, hey, I'm thankful just to be able to take this. I'm thankful that I had an increase, not a decrease. I'm thankful it worked. So that was a really humbling experience at that point. And that's where I kind of turned to be very thankful and hopeful of, hey, if this is what they've gotten done, what else are they going to get done? And then along came Trikafta, and Trikafta has made a world of difference. Prior to Trikafta, I was on a lung transplant evaluation list at University of Pittsburgh. My lung function was hanging around 30%. My doctor said, hey, how about we start this talk? Not that you need it immediately, not like next week, but let's get you down there to meet the staff, do an evaluation, see what they think. And that was February of 2019. So I got down there and saw everybody that was there for the evaluation, and immediately I felt like, wow, I shouldn't be here. It's they were all on oxygen. They were barely able to walk. They had to have a support person there to kind of really guide them at that point. My wife was there as my guide person, but I was walking 8 steps ahead of her at that point. So it was a really, again, a humbling experience there of, I'm thankful that I'm not on oxygen all day long. I'm thankful I can walk on my own. I'm thankful I can do a lot of those things still. And yes, I was on oxygen at night, but not like they were all day long, every day, every step. So that kind of made me step back again too and say, hey, I'm not as bad as I think I am. And I got that phone call saying, hey, got some good news for you. Like, you're too healthy. So, oh, that's good to hear. But I didn't feel like I was too healthy because I was still 30% lung function, and I was just over 100% at 18. I mean, that's not too long of a time frame where I went from over 100% down to 30. And then as soon as Trikafta came around, I was one of the first ones in Rochester on it. I was way ahead of everybody else. I was calling my insurance company like the day the FDA approved it. I wouldn't leave them alone. And I finally was able to get everything going, got the script sent over to the doctor, or the doctor sent it over, and I was on it within like a week after I started making these calls. And within a few days, I mean, honestly, in the first day or two, I don't know if it was the placebo effect, but I felt like $1 million already. It was like the purge. The first few days, all the mucus just cleared out of my lungs, and I felt like a whole new person at that point. I stopped using oxygen probably a month or so in. At night, I didn't need it anymore. I still don't need it. And I just feel tremendously different. I'm back to being able to exercise. I've got 3 kids I've got to keep after. I've got a full-time job that I have to go to that I need to be there for. And I've got a life I need to live. That's the big thing.
Yeah.
And I've got a lot that I'm a goal-oriented person. I've got more goals I need to reach. And back in 2015, I didn't know what the heck I was doing. Found out we were pregnant for the first child, and I was like, what am I doing? Am I even going to see this child go to kindergarten? That was my big fear. And now the kid's in first grade and spitting image of me, and tucks his shirt in every day to go to school because I tuck my shirt in to go to work. And it's just great. I'm able to play golf almost every single day. My 6-year-old is taking up playing sports with me, and he loves baseball. So I'm outside pitching to him. And just even 2 years ago, just prior to Trikafta, we were planning on building a home. We just got into it in November, but when we were trying to build our home, even the question of CF came into play of, hey, do I need to have a first floor master because I can't make it up the stairs? Things like that. Any decision I pretty much made is based off my CF. It's now I don't find it so much because now I feel quote unquote normal. It's I don't really, it's more in the back of my brain than the front of my brain. Now I'm saying, hey, now I'm going to see all 3 of my children graduate high school. And that's 18 years from now. I never thought I'd see the day past 30 at this point. And here I am 31. And I'm not even thinking of, hey, am I going to make it to 40? Am I going to make it to 50? It's like, hey, I'm going to see grandkids. It's a wonderful feeling.
I got to save for retirement.
Yeah. And that's the other thing is that thankfully, me being the optimistic person I started saving for retirement at 18. As soon as I got my first seasonal job, I started putting money away at that point. But unfortunately, growing up, we were always told, pack in the carbs, pack in all the protein, pack in anything you can. You need all this calories. And now you've got to be a little conscious of that because diabetes at this point, now we're living past what we were expecting. And diabetes already plays a role in cystic fibrosis. It's not just based on what you eat. It's just the medical history of CF. So I'm diabetic, so I've got to be careful with that as well. It's a lot of things you have to balance. And now though, with these modulators, it just makes it's one step closer to just feeling 100% normal. That CF is like an afterthought at that point.
Can you tell us a little bit about the decisions that you made about what treatments to continue, what, if anything, to give up? Do you still do airway clearance or do you use exercise? Can you tell us a little bit about those decisions since Trikafta?
So I still do all my medications. I'm a data and science person. I will not stop something until I'm shown in black and white of, hey, this is the study that's been performed over X amount of time. People's lung functions haven't decreased. You'll always get that one anomaly where it could be something underlying, something else happened, but that won't scare me off. But I need to see the numbers before I make that decision of, hey, let's decrease my nebulizers down to 1 or nothing. Let's decrease the vesting from 2 to 1. Let's drop this pill. Let's drop that pill. It's that I just need to see the numbers beforehand. That's how I've always been. I'm nervous to stop anything because I'm afraid I'm going too well right now. I don't want to take that step back and all of a sudden regret that at that point, have it be irreversible. So I'm still sticking to my normal regimen. I mean, there's been talk of, hey, we can drop Pulmozyme from 2 to 1. I've managed to do that, but I haven't noticed a difference. That's the only thing that I've changed, because Dr. Schofield said, hey, we can knock that down to 1. Let's see what that does. And my lung function hasn't moved a bunch at all. No, I don't even think it's really moved. And I don't feel any different.
And so what does your daily routine look like right now?
So I'm still doing my nebulizer, my Zopenix one. I don't do as 4 times a day as I always was doing, just because now I'm starting to feel that heart race with the albuterol in it. I never used to feel that because I felt like I'd need the nebulizer. Now I don't feel like I need that. So I'll stick to 2 or 3 times. On average, it's probably 3 times a day instead of 4. Morning and night, and then sometime in the afternoon at that point, especially if it's been a hot day out and it's just humid, things like that, that'll play a role into it. Or sometimes that middle of the day one, I'll just do an inhaler instead of a nebulizer. That's really the only change I've had. I still do my vesting 2 to 3 times a day. When I start feeling sick or I feel like I'm getting a cold or a sinus infection, instead of letting it get down to my chest, I'll ramp up my vesting to 3 to 4 times a day. I still stick to all that stuff. I'm afraid to stop it. That's the thing. I feel normal, but I know there's a different kind of normal with CF now. I understand that. And my normal is this.
So knowing that there are studies that are ongoing now about reducing treatments, what are your thoughts about that once we get some study results?
Once the study results are back, and if it's favorable at that point, or if it's like, hey, lung functions haven't changed, I'm more than willing to sit down with my doctor and he says, hey, let's cut all this stuff. Let's cut this off. Great. I'll listen to that. I'll do that. And then I won't do it all at once. I'll probably take a couple pieces off at a time and kind of wait a couple weeks, a month or 2, and say, hey, I don't feel a difference. That's great. Let's keep moving. Let's see what else I can get off of. Because obviously the less medicine you can take, the better it is on your liver, your kidneys, everything else.
Right.
So,
have you experienced an exacerbation since you've been on modulators?
Not a full-on exacerbation. I had a couple with Orkambi and Symdeco, but Trikafta, I honestly can't remember the last time I've had a full-on exacerbation. I've had some stuff like flare up where it's been cold or sinus infection where it's gone into my chest, where oral antibiotics never used to help me at all. I'd have to go straight to the IVs. I've been on Cipro now and just knocked it out in a couple of days, and I'm right back to playing golf the next day. That's the thing. It's just, it's a big difference. I feel like the over-the-counters or the Cipros, things like that, really helps me a little bit differently now than on Trikafta, because things kind of pass through the body a little more easily. It's not as blocked, and everything. My mucus is not nearly as thick and sticky as it used to be. I don't think my baseline cough is 0. The only time I'm coughing now is really like sinus related. It's the postnasal drip. Or if I wake up in the morning, it's all my throat's killing me from the ragweed out back. And that's the thing. It's when you live in New York, it's like constant allergy season.
That's right.
So I've joked with my wife. I think I've had a strep throat more than I've had an exacerbation the last year and a half, because my kids had strep throat and they kept giving it to me and we didn't even know. And I'm getting more normal person sick, as I call it, than CF related sick.
Yeah.
And I don't know. I feel like I'm more of a baby when I'm normal person sick than actually CF sick. That's the thing. My wife laughs at me. She goes, "You're a baby with that." I was like, "Well, I don't know what it feels like."
Yeah.
I'd never have strep throat prior to that. It was always CF something.
And when you're married to a nurse, you get very little sympathy.
Oh yeah, she has no sympathy. It's 0.
Well, that's really great. And it sounds like, I mean, it's not an exaggeration to say that the Trikafta has been kind of life-changing for you.
Yes, 100%.
That's great. And And so any advice for people who may be considering stopping things or have been worried about starting modulators? I mean, what would you say to people, if they were, as a practitioner, asking you, like, how do I talk to other patients about this? What would you have to say?
So I think it's really a personal preference with the patient saying, hey, I'm apprehensive on starting this. I mean, there's all sorts of different ways with the Symdeko and the Orkambi's or the Trikaftas to be starting it. Start off with one yellow and one blue. Just go slow. I've seen some people, I'm friends with some CF friends, and some of them were apprehensive about it. And I've talked to my CF friends about it, and they're like, well, you reacted well. I said, yeah, but you may not necessarily react well. It's all gonna be based on individuals at that point, and try it. At least try it. That's the thing.
Mm-hmm.
Take it as recommended. If you have to take one yellow one, one blue one to start off with, just do it. Try it, because it can make a world of difference for you. And you're nervous. That's like the vaccine thing. I was nervous to get hit by vaccine because I didn't know. I don't like the unknown.
Yeah.
But the next day I was working on my basement. That's the thing. I just did it. I didn't even think.
Yeah.
It's the same situation here. Just the science and the data show that it will help you. Be optimistic, have hope. I mean, if you're not eligible for any of these modulators yet, it's coming. They're working on this every single day. They're raising funds like crazy. Again, be optimistic, have the hope, know that it's coming. And every CF patient across the world deserves what I'm feeling right now, is a sense of normalcy, being able to live life with children, a career, set your goals to retirement at this point. Again, nobody was planning on for retirement with CF, really, because you're always told from day one, don't expect to live long. That's the thing, just live your life. But still keep with your regimen, keep with all that stuff. Again, talk to your doctor about it at that point of what they think, because they know you best.
Mm-hmm.
I can't speak to you about, hey, Donna, you should stop this. You know yourself best. Your doctor knows you best. But for me, as a personal preference, I'm going to stay on this until I see the data.
Mm-hmm.
And I know a lot of people like to see that. They want to see the data first before they stop it. And I'm thankful for the people that are doing these studies right now of backing off some of these medications, and because without them I wouldn't be able to make an informed decision. And I've been parts of several studies before, and it's gratifying. You like doing that.
Mm-hmm.
It's just an advancement. It's incredible. What they've done with CF already is unbelievable, and I can't wait to see what else they come out with at this point.
Yeah.
So
It's been an amazing journey.
absolutely.
Yeah. Well, thank you so much for sharing so much with us, and we really appreciate it. We are trying our best to offer people the right advice as they move forward, and your perspective is certainly appreciated. So thank you so much.
Yeah, thank you for having me.
Hello and welcome to our symposium session titled Airway Clearance and Exercise in the World of Modulator Therapy, Can We Lighten the Load? For this part of the session, we are joined by a couple of our patients. Both my co-chair Donna and I will interview one of our patients to hear their side of the story in the world of modulator therapy. So today and let me introduce myself first. My name is Karen Vonberg. I am a physical therapist at Johns Hopkins in both the pediatric and the adult CF programs. And I am joined today by Taylor, who is a person living with CF and is seen at our adult clinic. So welcome, Taylor. Thank you so much for joining us. And why don't we get started by you telling us a little bit of your CF story, when you were diagnosed, overall health during childhood, adherence to treatments, and exercise.
So, hi, my name's Taylor. I was born with cystic fibrosis in '92, and I was actually diagnosed the day that I was born. I had surgery the day I was born, and then I had surgery after I was born. So I've known I've had CF my whole life. My whole family has. It was never something to be quiet around. Everyone knew. I never really started getting affected by my CF until probably late puberty, probably around 10th grade to my senior year of high school. I started noticing I was a lot more sluggish, a lot more tired. I wasn't able to sleep at night. I was coughing a lot more. Daily tasks for people, like just talking, was a lot harder for me. I would have to stop and take multiple breaths, and I would breath off a lot. I played sports all throughout high school, and when I was younger, I wrestled, I played football. But then later on in those days, it was just so draining. I felt like I was just like constantly working out and constantly tired, unmotivated. And it even flowed into my work life. I started becoming a personal trainer. I've worked at gyms now for 10 years, and it was just getting harder and harder to work and then go and work out, because I would just feel like I've working 2 days in a row and not sleeping at all. And it's just like time and time again, just not having the motivation to work out because you're literally physically just tired. So that was basically before the whole Trikafta thing happened.
Okay. Now, throughout your childhood and into young adulthood, were you good? Did you take medicines regularly? Did you do airway clearance?
I think any child, when they're young, they don't want to do stuff that their parents and other people tell them to do. I was never super bad about it. I mean, there were times I would forget to take my medicine before I ate, or sometimes after I ate. And then, of course, you get your stomach pains. The only thing I really didn't like to do was probably my vest, just because it made you cough so much. That and the saline solution. I just hated the feeling of it coming up and having to do it for half hour in the morning before school. So you had to wake up even earlier, and then right before bed. And then if you do it before bed, it's hard to go to sleep, and just the whole feeling of it. Those are probably the only two things I hated doing the most, and I probably complained about a lot. But everything else, I didn't really find hard to do with everything else, because you get into that muscle memory of just doing it all the time.
Yeah, but it sounds like you maybe didn't enjoy the vest and the saline, but still did it. Yeah,
there was certain things that, no child likes to do, but, later on you realize, oh, I was a stupid little kid. I should have done it.
Hindsight, right?
Exactly.
Yeah. Before we get to talking about the modulator therapies, tell me, were you aware of what your mutations were prior to talking about modulators?
I was aware. I mean, I was told, but I mean, I never remembered it. I never remembered if it was a rare and a common, or a common and a rare, or a common and a common, or I just never realized it. And even to this day, like, I know it makes me look like a bad patient, but I don't even know what my mutations are anymore, just because that's how much I don't think about it.
Mm-hmm.
So.
Now, were you on any of the other modulator therapies prior to Trikafta?
If I was, I don't remember. The only things I really remember is doing a lot of like going to Philadelphia or going to Hopkins and doing testing for like different foods that kids with CF can eat and how much they eat and their calorie intake. That's really all I remember. I never really remember getting on any special medication or stuff like that. I was one of those very fortunate people with CF where if my lung functions went down, it was very easy for me to back up in a week.
Mm-hmm.
I've had doctors look at me like, there's no way that you back at 80% when last week you were at 50%. How'd you do that? And I've always been very lucky to have that.
Okay, good. And as you mentioned previously, the exercise, that was always a big part of your life. Sports when you were a kid, and then working as a personal trainer and doing your own workouts as well. I believe you told me it was every day, anywhere from 45 to 90 minutes a day, you would be working out.
Mm-hmm. And sometimes even longer than that, because like I said, I wrestled and played football. So I would do those wrestling practices, those football practices, and an hour later, after I had my dinner, I'd go back out to the gym for another hour.
Yeah.
So it's always one of those things where it's always in my work schedule.
Yeah.
Or day work.
That's awesome. It's a physical therapist's dream.
Exactly.
The time I met with you and you told me how much you were doing, I always just wanted to like take you and like sprinkle you over the other patients with CF as well and get them to exercise just as much. So let's fast forward to when you first heard about Trikafta. Do you remember when you heard about maybe trials that were going on and how people with CF were responding to this drug, or when you found out you were eligible?
Mine was actually kind of weird. I didn't find out until like a random conversation with my pharmacist, actually. Shout out to Jonathan, because he always helps me out. I was kind of in like this weird place where I didn't really want to do appointments. I just didn't want to be seen by anybody. I was just kind of done with the whole thing. And Jonathan he could sense that, and he was just talking on the phone. He's like, "Hey, I just want to let you know, it's kind of in the trial runs, but there's this new drug called Trikafta, and I think we can check it out and see if it's good for your genes and if you're eligible and everything." And in my head, I'm like, all right, whatever. I've heard this before. Like, there's always trials coming out. Like, I'm not going to be the one, but whatever. And he's like, I think we should do this. And I was like, you know what, man, let's do it. All right, we'll get you off my back. And so that's really kind of how I heard about it. It was anything crazy. I mean, I'm pretty sure the doctor didn't want to tell me because they want to get my hopes up. So it's just one of those just like in passing talks.
Okay. So I'm thinking back to the first time you and I had a specific conversation about this. It was before you started on the drug. It was a telehealth visit over a year ago. We hadn't seen you for a bit. And when I joined on the video visit, I kind of realized quickly this was not the Taylor I knew. You were really down in the dumps, to the point where I was concerned about you. You told me you weren't working out. You had lost motivation, but you were like willing to give this Trikafta a try, like a last ditch effort. Really surprising for me to hear that you weren't working out. I think you were still using your vest pretty regularly. At that time. That's according to my note that I wrote anyway, that you told me. So that was good that you were keeping up with that. But you were kind of holding out for this Trikafta, and you started on it shortly after that. So tell me about what changed for you once you started taking it.
So yeah, like you said, like before, I just got to the point where I was working out every day for the past 10 years and I just wasn't seeing any results. And then I was just feeling even more sick, and it wasn't a good thing. I developed depression and anxiety, and I just got to the point where my then girlfriend now, I was ready to die. I was just like, all right, I'm coughing all the time. I can't have sentences because all I do is cough and mucus comes up. And I'm only 100 pounds now, and I don't have any energy for anything. I was literally counting the days. I was like, I'm just gonna lay in bed. Whatever happens, happens. And I could see it in my family, and I just didn't care about anything anymore. And so when I started Trikafta, I didn't have the same effects that a lot of other people did, where you take it for a couple of weeks and your body's aching and it feels like you have the flu, and your body's just taking all the mucus out. I never had that. I was very lucky and fortunate where I just took it, and after a week, I just literally stopped coughing. I wasn't gasping for air. I didn't have to take my best because I felt like I needed it to survive. I just took it because I was like, oh, I didn't go for a run today. I could do my best and I'll be fine. I don't have to worry about it. I was sleeping. I slept for the very first time in 10 years, a whole entire night, which I was never able to do. So it was very easy transition into start. It was only 3 capsules a day. And my appetite got bigger. I was eating so much more. And I think in the first month I gained almost like 10 pounds, which was really good. It felt weird walking around because I had that extra weight. And being a personal trainer, when it feels like I have all that stuff. And, so that was pretty cool. Yeah. Like I didn't want to like acknowledge like, oh, so great, blah, 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 blah. Like deep down, like my friends knew. They would be like, we know you're happy. Like my best friend Isaiah would be like, it's night and day. Like I'm so happy for you. Yeah. And like just people start recognizing it. My mom would actually come into my room and be like, are you good? I'm like, what do you mean? She's like, I haven't heard you cough. And I'm like, no, I'm good. I'm watching a movie. That's the kind of the cool upsides about it.
So it sounds like it really affected every aspect of your life, your mental health, your physical health, your sleep, your nutrition, kind of everything saw an improvement once you started taking it.
Yeah. And I'm not going to go to the gym if I know this works. If I go to the gym and I get my hopes up, I'm not going to be here anymore because I'm just going to feel so bad. So I waited, I think, 2 to 3 months before I even hit the weights. That's how nervous I was.
But it sounds like you were doing some exercise still. You mentioned running.
Yeah. Mm-hmm. I'd wake up and I'd actually run. So.
Okay. Yeah, that's fantastic. And what about your vest use or other airway clearance? Where are you at with that now?
So it's kind of funny. I was taking my nebulizer twice a day. I was doing my vest twice a day. And then it's weird, when I hit the 4-month mark, I kind of I would use my vest, but nothing would happen. I wouldn't cough. I wouldn't do anything with my nebulizers. And I'm like, I've always been one of those risk takers. I guess that's my downfall sometimes. And I literally stopped taking it. I stopped doing my vest. I stopped doing my breathing medications, everything. And I remember my doctor's like, hey, you still doing this? I'm like, yeah, I do it sometimes. Or I'm like, all right, cool. And I think in my 6th-month mark, I got the gumption up. And I was telling my doctor, I was like, I'll be honest with you, I have not taken this. I haven't taken my vests. I haven't taken my medicine, my breathing medicine. And I'm running more and more and more. And I personally don't think I need this. And my doctor was like, awesome, cool. Let's take you off. Let's do this. Let's do that. And it took me back. And I was like, wow, that's awesome. I don't have to take this medicine anymore. I don't have to vest anymore. I literally just put it up. It's in my garage right now. And I haven't touched it in almost a year. And I don't have to have all this medicine stocking up my fridge and all this this big weight over here that's gonna makes me shake, and I have more room now. Yeah, so it's pretty cool. I don't have to take any more medicine anymore, and it's all dumbed down and just pills, which is really cool.
So you kind of on your own weaned yourself from treatments.
Yeah, I did. It's probably
okay.
Probably not the best. I don't think any other person should do that. But I kind of, like I said, being in the medical field almost my whole life and working out, I know my body. I know what my body responds to, even with breathing and just coughing. I'm pretty well adjusted of how my body reacts to certain things.
Mm-hmm.
So I could just tell after about 4 to 5 months, hey, I really don't need this anymore.
Yeah. And I think that's hard for us as healthcare providers to just say, it's okay. You don't have to do it anymore. And that's what this session is whole about. This whole session is about is really finding the different perspectives, learning about the science that's going on. And, we really appreciate you sharing your side of the story. Before we close out, anything else that you want to share about your CF journey, your modulator journey?
I guess just personally me, don't be afraid to let people in on your struggles, because that's going to really affect how you act as a person. And your mental health is a big thing, and I never thought it was. So don't be afraid to just try new things and reach out and be responsive of what people say, and literally just try. That's really all it is, because in times that we have right now, we need more people to just try and be there. So yeah.
Gonna make me cry. All right, Taylor, we'll wrap it up at that. Again, I appreciate you so much for sharing your side of the story. And yeah, that's all. Have a good one.
See you guys.
Hello, and welcome to our live panel discussion of Symposium 5, Airway Clearance and Exercise in the World of Modulator Therapy. Can we lighten the load? Thank you for watching the presentations by Drs. Getz and Russo, as well as the patient perspectives from Mike and Taylor. My name is Karen Von Berg. I'm a physical therapist in the adult and pediatric CF programs at Johns Hopkins in Baltimore, Maryland. And I'm joined today by my co-chair, Donna Gurmuga, a respiratory therapist with the peds and adult programs at University of Rochester in upstate New York. Donna will be managing your questions and comments for our panel today. And I've seen some activity on the Q&A and the chat tabs already today. And I do just want to point out to please use the Q&A tab for anything that you want, any questions or comments that you want to come through to our panelists today. That's what Donna and I will see on the back end. And we'll be able to get those questions to our panelists. I also want to make note that you can upvote any of the questions you see. If someone poses a similar question, you can click on the thumbs up button to give it an upvote. A few questions already have been about, are the slides going to be available? Are there handouts? Wanting to get the resources, the reference list. And I will note that these sessions are available through the end of the year. So you can go back and rewatch and pause and write things down. And we'll try and drop the presenters' emails into the chat if you have any specific questions. So thank you all of us for joining today, and time to get into the questions here. So let me just pull up my chat. One question to start us off for Joe, Dr. Russo. I'm curious if you still think most patients on highly effective modulators and their providers would rank modulator third most important item on the importance or burden of care survey. The data is from 2020, and I would say it's already outdated. I would think it may be number one for the majority for now. Any thoughts on that?
Yeah, I would agree. So for that specific reference, I was really kind of focusing, I think, more on the exercise and how that was ranked by patients and providers, and how that will also likely shift in perspective as well. But I agree. I think modulators would be top of the list for me.
Yeah, it's wild how quickly things are changing. Kind of difficult to stay on top of all of the evidence as we're seeing such rapid changes. For Dr. Getz, question about the exercise studies, and do you know if any of them specifically looked at high intensity interval training in terms of I believe this is in reference to comparing it, is it an effective airway clearance?
Not that I recall, but I would have to go. I was just trying to do some literature searches on exercise, and most of the studies seem like they were PEP therapy versus like a short duration exercise. So like on a treadmill. So I think that's a good question that I probably need to look into more, because I know that's probably something that more people do nowadays, is the interval training.
Yeah, I would agree that it's a newer trend, and a lot of the exercise articles are probably more traditional aerobic exercise and strength training.
Taylor might know more about that as because he's actually working with folks as a trainer, but.
For Mike, if you're comfortable sharing, we had a question about your mutations and if maybe they didn't pick up on the diagnosis, if they were more rare. And then also, again, if you're comfortable sharing, people are wondering what your FEV1 is now.
Yeah, so I've actually got 2 copies of the F508. And my FEV1, when I've been healthy and haven't had any colds or anything going on, I've been between 50 and 54%. When I've been sick, it's only dropped to about 45 to 47. So that's not the 30% that I used to be at.
That's fantastic. So we had a question come in about the expense of PT and copay. And Dr. Russo, I believe you mentioned in your talk that you got PT involved. Do you have issues with payment, patients owing copays and deductibles, or how are you funding PT?
Yeah, so at our center, it's still kind of a physical therapy kind of a referral. We haven't had any reports of any issues with insurance not being willing to pay. I think the patients are given at least an annual assessment. We're hoping. We just kind of started our program. And then if there's documented need for additional sessions, I think that as far as I know, there's been no issues with coverage.
That's great to hear. Dr. Getz, I'm curious, do you have PT at your center and any issues with billing or funding?
No, I wish we did, but we're the same. We have to refer out, but I haven't heard issues about. There are specific, like for Medicaid, a large proportion of our patients are Medicaid, so it is sometimes the places we refer may not accept Medicaid. So I would think that would be the only issue that we're up against more often.
Okay, great. And I hope I'm allowed to do so. There's a PT RFA, a request for applications, a grant that the CF Foundation has partially funded the role of PT in outpatient CF clinics. It's a partial funding for up to 3 years, and there will be a new cycle starting next year. So for those centers that don't have PT involvement or are struggling to keep PT involved, keep an eye out for more information coming on the next cycle of the PT RFA. Taylor, have you had any change in your lung function since you weaned off of airway clearance?
I actually recently went to Hopkins. I wasn't able to get my lung functions done because of a certain thing that happened. But just from being on Trikafta, I think I started it at 33% back when I had pneumonia and all that stuff. And now just feeling, I would say I'm probably around 60 to 70. That's even with my take-home spirometer. That's what it usually, my take-home spirometer is saying around 70. Obviously I can't read it that well because they're very hard to read, but I would say probably around like 60 to 70% right now. Okay,
great. Let me just see where our next questions are here. For Dr. Getz, do you know of any trials and what the current status is where they're withdrawing airway clearance therapies for this population of people on the highly effective modulators? Any insight there?
From the TDN meetings, I would say, the Simplify trial that Joe mentioned is ongoing, and that was more testing hypertonic saline and pulmozyme. So I'm not aware of any that are specifically like going down on the frequency of airway clearance therapies themselves. So I think that would be a great trial, although running it over a certain amount of time. I feel like as we've seen from the survey I did, probably quite a few patients are already doing it themselves. So maybe some kind of retrospective trial looking at people who have stopped their therapies versus those who have not, and comparing would be actually more feasible than doing a prospective trial where you're looking forward.
Yeah, yes, definitely. To follow up on that, Dr. Russo, what further research do you think should be done regarding airway clearance and exercise in this post-modulator era?
I think that an area for kind of consideration for more research would be, I think we need to be a little bit more specific about when we do put exercise into one of the trials, when we're considering more of peeling back some other therapies, that we're pretty specific about the intensity, the length of the sessions and modalities. I think that there's still a lot of room for specifics that need to be looked at about the exercise prescription in terms of effects that this is going to have on airway clearance. I think there's still a little discrepancy with different modalities, different durations. I think we just kind of need to get a little bit more on the same page with that and be specific.
Okay, thank you. For Mike, you mentioned you're very data driven and waiting for data before you reduce or stop your treatments altogether. The question is, what data did you reference for decreasing your pulmozyme from twice a day to once a day? Or was that more of a, you kind of were willing to give it a try without the...
So that part I was willing to give it a try a little bit. But also talking with my doctor, he said that he's seen other patients at that point, patients of his, that have gone from 2 to 1 just because insurance purposes stopped funding twice a day use. So they've had to go down to once a day use, and they haven't seen any decreases at that point or any effects of dropping it to 1. And again, knowing my doctor for God forever, it feels like now, and being part of the U of R system, just I trusted that, and he is a data guy too. He's a doctor. He goes by the science.
Mhm.
So and again, they've never just steered me wrong, and I'm glad I made that choice at that point.
Good. And another question, I'll stay with you, Mike, and then
Yeah.
Taylor, you answer it as well. I know Taylor mentioned using the home spirometer. I'm wondering, are you using a home spirometer, and how often are you monitoring what you're
I probably check it a little too frequently. Just like my diabetes, I've got that Freestyle Libre, so it's just easy to check now. I'm always looking to get that extra 1% out of my lungs, but probably once every other week, I'm probably checking it. And like I said, it's more than I need to be. I think it's more of a fun. It's convenient. So yeah, I've been doing it at that point.
Okay. Taylor, how about you? How often would you say you pick up that spirometer?
I'm gonna be honest, probably like once a month. I'll run if I notice my running's I can't run as much, like I can't do 2 miles a day. Or like in a whole month, I can't run a certain amount of miles. I'll kind of like taper back, and I'll think, all right, so why can't I do that? Let me check my levels real quick, see if I can taper something out. If I do need to take, watch if I'm eating too much there before my run, is that affecting my breathing, all that stuff, and just kind of like checking that out. And then if anything does like abnormally happen, I'll give the doctors a call, be like, hey, notice it's kind of low, like really low. Am I doing something wrong? What's up? And then that's when we'll take action if we need it. But yeah, like once a month. Obviously, I don't have diabetes. I don't have some of the stuff that Mike has, so I don't have to. I personally don't have to check it as much as him. But yeah, that's just basically me. Probably like once a month. I'm very lucky. So.
Okay. Thank you. We'll stick with you, Taylor, and then Mike, same question will come to you. Taylor, you talked a bit about mental health during our interview. And the question is in regards to COVID. How has COVID impacted your day-to-day life, specifically mental and physical health?
So I started having, like I said, in the interview, when I started feeling a lot more sluggish, and my lifting and working out wasn't really helping and doing anything, I noticed that I was really down the dumps. And then just from that kind of washed down to my personal life with my girlfriend and my parents. And it really affects every part of your life. It really does. And then that mental, it's a waiting game, because you can, after high school and everything in college, it's like life hits you and everything hits you. And then COVID hits. And it's like, now you have all this stuff that you're dealing with your CF. Then COVID hits and you can't go out. You can't do certain things. So all that, I like to talk to people, I like meeting people. I can't be around anybody. I'm sitting at home and I'm in my thoughts. And so that really, really affected me. And then I can't go to work, and you're not making money, and you're not helping your family. So it takes a toll, and it's very hard. And I don't know about how Mike is, because Mike obviously has a family and 3 kids that he has to look out for. So I'm sure it was a lot harder for him. But with me, it affected me a lot, to the point where I had to get out of Maryland. Like I literally left Maryland and I went to Utah for almost 4 months just to get my head clear. And that's how bad it got. And my parents and friends were very worried about me. But when I got back, I was lucky I got to meet with my friend Chris and his girlfriend Addie, and they looked at me like, you're like a new person. Like, wow, like this medicine's doing great. You got your head clear. Like that's awesome. So I know we're not over it. We're not out of it. Hopefully we will be in the next maybe the next year or a couple months. But yeah, start of COVID really took a toll. And now it's like, I finally got everything under control. I'm good. So.
Good. I'm glad you were able to take that time and get out of your head or get into your head in a good way.
Yeah, exactly.
To Maryland and take charge of your again.
Exactly.
Mike, how about you? What kind of impact did COVID have on your overall physical and mental health?
Well, I feel like having CF kind of prepped me for the day of COVID coming. I mean, you had to wear face masks all the time. No matter what you did, you're always keeping your hands washed, hand sanitizing, having a wife as a nurse as well, too, taking care of COVID patients. I mean, I've got 3 germ-making children at home, and they bring home anything and everything. I think I probably had more COVID tests than anybody combined on here. It's been crazy. Kids have a cough or anything else, I start getting sick, and every thought was, oh, could this be COVID? My brother-in-law actually was temporarily living with us, and a month and a half ago, he actually came down with COVID. So that was kind of a scary situation there because all of the kids were around him, everything else. Luckily, he was able to stay downstairs where we've got a finished basement. He was able to stay down there, but I never even had a sniffle, and it was just bizarre to me. Usually I'm the one that picks up anything and everything. So I'm conscious of everything. I mean, I work at a bank. I'm a financial advisor, and I deal with people all day long, every day. So I keep my distance. Most of my clients know that if they're sick, they stay away. They'll call and cancel. But now it's even more so with COVID. They understand the fact that if I get sick, even a cold can put me in the hospital at that point because I can turn to pneumonia, anything else. But it's always in the forefront of my mind. Again, I'm a positive person, so I don't think it's really impacted me mentally. I'm always optimistic with everything. That's the thing. So I haven't really noticed that difference.
Okay, good. I'm glad through it okay. Dr. Russo, do you ever refer your patients to outpatient pulmonary rehab services?
That is something we have not done. I could say we don't have a lot of experience doing that, but just mentioning again, trying to establish more of that physical therapy kind of relationship is kind of where we started things about a year ago through a quality improvement project, just to get some more involvement and interaction. But that's a good thought. I'm not sure of all the resources we might have to send our patients to pulmonary rehab.
Dr. Getz, I'll throw it your way next. Being a physical therapist, having been in the field for more than 20 years now, my role has evolved over the years, from airway clearance and exercise to getting more into the nitty-gritty of pain and pelvic floor dysfunction, vestibular issues. I'm curious, where do you see the role of the physical therapist going with highly effective modulators? We heard about more people exercising, there's weight gain. Do you see there being more of an involvement, less of an involvement? Just curious your thoughts there.
Definitely. I mean, I think there should be more involvement in terms of pulmonary rehab programs for pediatrics. I think are really hard to find, but for adults, I think we need more things for adults that that people are going to be living so much longer, and they want to lead these healthy lifestyles. So I think we need more people to, kind of like Dr. Russo said, enforce living healthy lifestyles, or not enforce, but recommend or help people live healthier lifestyles. I think in general, we need that in all of medicine. So it kind of goes along with that. But I think, like pain syndromes, joint pains, I think, are more common. So I think we definitely need physical therapists, and people getting older, we need more support for that.
Yeah, absolutely. I that the whole elderly population gonna shift our role once again. That's a great point there. For Mike, what feedback do you have? We're putting you on the spot here because she's in session. What feedback do you have for your RT or your PT about how we can better support and encourage where you are on your modulator journey and, incorporating airway clearance and exercise?
So to be honest, and not just because she's on here, she's incredible. She even dealt with me when I was in peds. So when she was over the adult clinic, obviously it was a warm welcome to her, or for me to see her, but she's tremendous. She always accessible through my chart. She's always constantly asking what they could do to help. There's just the complex care center in Rochester as a whole, not just the RTs, but is fantastic with that. They're always staying up to date with checking your liver count, everything else, making sure it's not affecting your liver any. She's in constant communication, it feels like, with me, making sure I'm doing all right, I'm taking my meds all right, I'm getting it all right. Even parts that's not even really her role, she genuinely cares and is there for you. She feels like an extended family member at that point. I mean, she loves my kids, everything else, so it's great.
That's fantastic. It sounds you have a wonderful second family.
Absolutely.
At
Absolutely.
CF Center. Fantastic. Taylor, being involved in sports from a young age with your background in personal training, the question is, how young were you when you started being involved in sports? And was this something your family supported or encouraged? And what advice do you have for parents of children with CF to be more physically active from an early age?
So one thing that I actually took away from this that I thought was interesting is me and Mike kind of had the same family upbringing. My mom is literally the one that was always there. Like, she was there. And my dad left at a young age too, and out of prison. So I kind of get where Mike was coming from, or his mom is literally like we'll tell you now, we're mama's boys. Like, we're whatever mom needs. Like, in the morning, my mom calls me good morning and then sends me coffee emojis. Like, she's very in my life. I'm also Italian, so you know how Italian mothers are. So my mom was very, very scared because I was a lot smaller. And so when I hit puberty, I think I finally got to 5'6", and that's where I was staying. So I was a small guy. So she was very scared that I was gonna get hurt really bad in wrestling, because it is a very physical sport, and football as well. So she was very, very scared. And I have an aunt that has diabetes. She's had her whole life. And she literally pulled my mom aside. I was like, listen, he's going to do it whether you want him to or not. Would you rather him sit in a room all day and just hate his life, or go and have fun with other kids? Things are going to happen. Let it happen. So that was a very big thing that I had to kind of have that talk with her a couple of times. Be like, hey, I get it. I know I'm here and you don't know how long you're going to have me and this and that, but you have to, at some point, you have to let me have control of my life. And as a parent, as you guys know, it's very, very hard. And I'm sure now Mike is seeing that with his kids and how he has to kind of taper off sometimes, let them do them. And that's how parents are. We're very loving. We want our babies to be good. So I got that from my mom. But yeah, at that point, once you get that through your parents' head, hey, we're not porcelain dolls. We have to do stuff. We have to get out there, because in the end, that's going to help. I think a kid with cystic fibrosis would benefit tremendously with doing sports, even if it's not a physical sport like track. I think track's amazing. Anything that's going to get them up and moving and have their lungs pumping, and the younger the better. It's going to, that muscle is just going to build, and it's going to be a lot better. Kids getting up into high school and college level, I think what you were talking about earlier, I think HIIT is probably the best workout for someone with CF. It really is. Not only is it helping you get your heart rate up, it's helping that breathing. It's also building those muscles. It's helping those joints with the proper multivitamin, helping those joints build. I just think all around it helps that person, anybody, honestly. So yeah, I think getting your kids into sports at a very young age, and then showing them, hey, you're not a porcelain doll. You can do this. I got your back. Obviously, taking them aside when they need to. But yeah, I think sports is a very, very important thing that needs to happen more with people with disabilities like cystic fibrosis.
Yeah, and I'll say, just to follow up on that, from experiences I've had, not all kids like sports, and I think that can be a struggle for some parents.
Mm-hmm. Of course.
kids to be involved in sports because they understand how important activity is. And for those kids that just aren't doing it, getting out and doing stuff together as a family is just as good. Going for hikes, going for bike rides, running around at the playground, climbing on things, those activities help to build that base and hopefully, start to encourage that lifestyle that they will continue with as they grow up and are able to make more of their own choices as far as how active they are.
Yeah, it really starts with you guys. It starts with the parents, because the kids are not, we're lazy by nature. I mean, that's what people are. So just the younger that you can get your kid just interested, that's cool. Like family walks, like you were saying, go out and play Pokemon Go with the family. Do something that's going to get them outside, get those lungs moving. And I think that's the best thing for a parent to do.
Yeah. To follow up on that, Dr. Getz, to get your professional opinion, the question here is how best to establish exercise in kids to meet those measures that you mentioned, as far as meeting that % of heart rate max. And also a side question, do you do any formal cardiopulmonary exercise testing with your patients?
Yeah, those are great questions. So the cardiopulmonary exercise testing, we, with COVID, things were shut down and we had somebody retire that was here many years, and we're able to set up our program again. We're hoping in 2022. So I would love to start doing that more often, but I know a lot of centers do that. And then in terms of establishing a routine early, it was funny when you were talking, I was thinking of a story where I have a newborn, I just diagnosed like 2 months ago with CF, and the parents were already asking if they could buy a trampoline, one of those little trampolines. And I was thinking, that's awesome. They're already thinking of, ways, because those are just fun and things they can think of that would be easy and they can incorporate. So because like you said, some people, don't want to be in the soccer team, but if they can do things like that together. Did I answer your question? I feel like there was another slant to it that I missed.
Just about meeting that specific % of heart rate max.
Oh, yeah. Yeah, so exactly. Yeah, so it's easy if you're on the soccer team and you're just running all the time. But some kids, they love baseball, so I don't want to take that away from them or whatever. So yeah, I think like you said, it's going to be like the hiking, brisk walks. Our respiratory therapist is always talking to people about, okay, you can't just how tweens and teenagers are always saying, well, I go for walks, but they're just like hanging with their friends and kind of like doing too much walking or doing more talking. So I think like things where you can really increase your heart rate and get up, just try to get them ingrained in that as a family, like you said, and if they can't do the teams. Yeah.
Great. Thank you. Sorry, let me just scroll here. Mike, what's your follow-up schedule like with your CF clinic? Are you going quarterly? Is there any telehealth?
There's been a lot of Zoom lately. I've just done the home spirometry, screenshot it, send it over to Donna every time. So I've talked with Dr. Schofield and Donna and the social worker, everybody else. It feels like it's pretty much quarterly though. But it's normal. That's what I've always known is, I don't think the last time I've been quarterly was probably when I was 17, 18 years old, but for a while I was seeing them pretty much monthly because I was sick all the time, whether I was in the hospital or what I was, but a normal to me is quarterly.
That must be nice to have.
Oh yes. Normal. I mean, I love them, but I don't want to see them every month. So
exactly. Exactly. Dr. Russo, not sure if you'll be able to answer this one, but we'll give it a try. A question came from Canada where Trikafta is funded, but has tight criteria of compliance to routine therapies. So how will the CF team help to advise patients to make these changes without risking losing that drug coverage?
Yeah,
jumping from Florida to Canada.
Yeah, I'm not as familiar with the structure of how they might not qualify for Trikafta if they don't meet certain standards of care or like self-care. But I guess I guess in general, just, and I guess what's the question, I guess, specifically? Is it kind of like how we help the patient?
So it says that the funding of Trikafta is related to their compliance to all of their other routine therapies.
Okay.
So, you know, we're talking about decreasing therapies and any ideas for advice for the CF team to help make sure that patients don't lose their coverage. I think that's the question. And this may not be something that we can answer since we're all based in the US here.
I did have a patient from Toronto because they only recently in Canada got approved for Trikafta. So a patient was actually coming and paying. He had a kind of a benefactor that was paying for Trikafta. So I saw him here, a 16-year-old with reduced lung function. But I would say that I would just, I mean, nothing is really official that we should decrease any treatments. So unfortunately, I think we might have to just advise them to continue, you know, their treatments and not everyone, you know, adherence is always, you know what I mean? It's never perfect. I mean, we're humans. So I don't know that there's a way we can get around that right now. I mean, it's just you document best you can what people are able to do. But yeah, that seems difficult because if you wanted to go down to one treatment a day from 2, for example, and your doctor and the person with CF felt it was safe, it might be hard to do. So I think it'll evolve with more evidence, maybe. I'm hoping.
Yeah, thank you for jumping in. I forgot, being in Buffalo, how close you are there to the Canadian border. Let's see, what else do we have here? Talking about telehealth or telerehab as an adjunct to care in order to help with adherence to prescribed exercise interventions. Sorry, as I'm reading through, I'm not seeing quite, I guess just your perception on telehealth as an adjunct to care. Dr. Getz, how much have you used telehealth, and do you see it being a way to continue with, maybe for PTs with exercise interventions, RTs, and PTs checking in with airway clearance, et cetera?
Yeah, I think for some things that had been really helpful during part of the pandemic, like you said, when you had to do more of the home spirometry, it was really helpful that we could do telehealth for the RTs to check in on how everyone was able to do that and get the results and send them in. So I think, and those sessions were helpful too, because then she could actually see what they were doing in the home, which is always great. Because, we sometimes have people bring their vest in, but it's really nice if you could just view it from home. So I think it would be nice to continue that way. We have gone back to almost all in person for pediatrics, but I think I think it'll be a useful feature for, adults and all people with CF, especially if they live really far and there's a way we can decrease. I don't know if the quarterly visits will always be the norm. I would guess not. But if there's a way that some of the visits could be telehealth, it may make things a lot easier. But yeah, I love the check-ins with different members of the team. If they can be done by telehealth, it would be great.
Yeah, I think it would be really nice to get more frequent check-ins. Sometimes by the time people come back, even for that quarterly visit, it's like, oh yeah, I did that for a week and then I forgot. So more frequent check-ins would be really nice. And I agree, seeing them in their home environment can be great. For Dr. Russo, this question is coming from an RT, and they're saying they've had patients admit they're not regularly doing pulmozyme or saline treatments or airway clearance after starting modulators because they feel they're not producing sputum, so there's no value. How do you respond?
So I think we give the patient the best information we can. So I don't think that at our center, I don't believe we've kind of endorsed any of the patients to just stop their treatments at this time. I think we still encourage them to still do their airway clearance. We're one of the sites for Simplify, so in those cases, well, that might actually disqualify them if they've already done that. But I think that we just try to reiterate the importance for now, and that we're hopeful that we'll get more data behind their decision. But I don't think we would officially support the patients completely stopping those other therapies right now.
Okay. For Mike, we got a follow-up question on the telehealth. Do you feel, and Taylor, I'm going to give this to you also after Mike answers, so you can start thinking about it. Do you think telehealth has helped or hurt overall care? Do you feel it would be helpful to continue once the pandemic is over, to encourage, the PT, RT, and nutrition and other aspects of CF care?
I don't think it's really hurt at all. It's normal to me now. It's been a year and a half, but post-COVID, if we ever get back to that, I wouldn't mind doing telehealth. I mean, again, the CF center here in Rochester is very accessible. If I'm having an exacerbation, I also use my doctor as my primary care physician too. So if I'm having a normal person sick issue, I can go right in. They get me right in. The nurse gets me right in. So I can still have that in person if I need it. Or if they're like, you know what, we can't really assess you via the computer screen. Let's have you come in. So I just like that they've got that as a back pocket where they can still see you in person if you wanted to. But again, I work full time. It's a little more convenient. I don't have an immediate need of, hey, I need to get in there, because then I've got to block out my calendar to go in. And being in person, it can take an hour, it can take an hour and a half by the time you get through the social worker, the nutritionist, the pharmacist that's there. Then you see Dr. Schofield, then you see Donna. I mean, it can take a while. So doing this telehealth stuff and doing your spirometry just with the home spirometry, I mean, it's not as accurate as the one that's in the office, but it's pretty close. So I'm good with that. I don't need to see that exact number. I mean, it might be off by like a percentage point here and there, but that's it. But yeah, I've got that in-person availability if I wanted it, but I wouldn't mind doing telehealth continuing.
Gotcha. Taylor, how about you?
I think what Mike said, he hit the nail right on the head. The only thing I would change is I believe children and teenagers should probably go in to the doctors a little bit more than telehealth, because they don't know that much about this until they get to a certain point, at least at least in the adult program, at least they're 18, 20. Because I know when I was younger, I knew certain things, but my mom didn't. Doctors don't really tell you everything. They'll tell you one thing, but you don't know what that means. So I just feel like kids to a certain point, they need to go see those doctors. It helps with their socializing. That's one big thing. I just feel like kids and teenagers need to be in person so they can understand how serious this really is. And then once they get to that point, once they get to that point, they kind of graduate that, and then, hey, I don't need to come in every time. I know what a spirometer is. I know how I'm reading a spirometer. I know how my, how if I'm on a take-home IV, I know how to do the medicine myself without my mom watching me. I'm okay with that. Kind of, graduating to that point. And as long as there's perimeters on it, I think it's a good thing to stay at home. Just as long as you're a kid, you should really go in there and really understand everything that's happening with your body and with your mutation and your disease.
Thank you for sharing that perspective. It's very insightful. We are close to the end of our time today, so I don't want to keep anyone late, and we'll probably get closed out of here anyway once the clock strikes 1 o'clock here on the East Coast. So I want to take a minute to thank our presenters, to Dr. Getz and Dr. Russo. We really appreciate you taking time and to share your expertise. To Taylor and to Mike, wow. Thank you for sharing your expertise as well. It really is so helpful for us as healthcare providers to hear your side of the story. And I think going forward, we always need to honor the patient side of the story and their expertise, and provide a balance of our expertise as healthcare providers, and meet patients where they're at, provide the education as needed, provide the science to back things up, but we need to hear what's going on with their bodies, especially in these rapidly changing times that we are living through right now, with all of the progress with CF science and highly effective modulators. I think we're going to continue to see things evolve. Thank you to all the participants who are here being engaged and asking questions. And again, this session will be available through the end of the year if you would like to go back and rewatch. And quick plug, USPTs, so physical therapists in the US, we are meeting tonight at 5:30. I don't know if Matt Bowman dropped that link in the chat. If you didn't, do it now, Matt. Donna, any parting words?
Nope, just thank you so much to everyone for your participation and for the audience questions and being in tune. And it was a really fun presentation to do. Thank you, Karen. You were a pleasure to work with.
Right back at you. All
Thanks,
right.
everybody. Enjoy the rest of the conference.
Yes, please do. Take care.
Bye.
Bye.